Ballad Health CEO and an area federal legislator both expressing major concerns about a Senate provision in the federal spending bill currently being debated. Those concerns center around a technical part of Medicaid funding, something called provider taxes, that states often use to access additional matching federal dollars to boost their Medicaid programs. Jeff Kaine spoke to Ballad CEO Alan Levine and Congressman Morgan Griffith and has their take on the current situation. What did you find out, Jeff?
Casey, Ballad and other hospital systems in Griffith's district serve a lot of Medicaid patients. A plan in Tennessee would increase that provider tax, and that could send a lot more revenue Ballad's way. But the Senate proposal wouldn't allow that and could also decrease current Virginia Medicaid funding.
I agree philosophically the provider tax is a bad concept. What they're doing is they're charging sick people a fee on their hospital bill.
He may not like the so-called provider tax that states use to increase their Medicaid funding. But Virginia Congressman Morgan Griffith is even more concerned about the Senate's current proposal to cap the top rate on that tax.
They'd have to show me how my hospitals are going to be able to make it. If you've got some other way to fund, that's fine.
Ballad Health CEO Alan Levine said the proposal, it's not in the House-passed version of the federal spending bill, would hit Ballad's Virginia hospitals hard.
The Senate bill would cost us $32 million in Virginia.
Far more in Tennessee, where an increase to the current 6% maximum tax would come back in much higher TennCare reimbursements for hospitals across the state. Reimbursements that currently don't even cover hospitals' costs.
That puts us in a positive operating margin environment, provides us the cash flow we need to pay for things like the new ER, the expansion at Franklin Woods, a new hospital at Unicoi, all the things that we want to capitalize. Replacement of equipment.
About $130 million a year on the Tennessee side for Ballad. After several years of large wage increases and climbing drug and supply costs, the system posted a $45 million operating loss from July 2024 through March of this year, and Levine said many other systems are in worse shape.
You take $130 to $150 million away from that, it's not hard to understand why all of a sudden capitalizing becomes very difficult. That's the beginning of a death spiral for a health system.
Griffith says the Senate proposal would hit particularly hard away from cities.
That's devastating for all of our rural hospitals, not just the Ballad hospitals, but other hospitals in the 9th District. That's going to be a real problem.
There's fierce debate on the matter in the Senate. Griffith and Levine both hope for a pullback.
We've got to figure out where we're going, and we have to do this in a more gradual way.
I think we've got allies in Washington that are trying to make these arguments, and all I can do is just continue to try to provide them support and the information they need to make the arguments.
And we reached out to Virginia and Tennessee's 4 senators on this. Virginia Democrat Tim Kaine is opposed to the bill generally, but he also said the Senate provision, quote, would have disastrous impact for rural hospitals. Look, America's healthcare financing system is really complicated. Levine described it as being held together with duct tape and said if you take away a piece, you don't know what else might happen. If you want more details about provider tax and these proposals, check out my companion story at WJHL.com.